Hello friends, this is Pathology Basics. This is a channel intended for MBBS and paramedical students. I am Dr. Ashish Jawarkar. I am Assistant Professor at Parul Institute of Medical Sciences and Research, Vadodara. I am a professor in pathology and my lectures are intended to teach you the basic concepts. These lectures are based on Robbins' textbook of pathology. So I have borrowed quite a few illustrations from Robbins' textbook as well as from the internet. These lectures are solely intended for teaching purposes and not for any other purpose. Hope you enjoy the lectures. To begin with, I'll start with chapter number 2 in Robbins. This includes adaptations, cell injury, and cell death. In this video, I will go through adaptations portion. Rest of the portions will be covered in the next video. Hope you enjoy. So let's start. This chapter begins with two concepts. First is homeostasis and second is adaptations. Let's look at homeostasis first. As you must be aware, homeostasis is a phenomena by which the body maintains itself or regulates itself. If I consider the example of regulation of body temperature, when the body temperature falls, what happens is the blood vessels constrict, as a result of which heat is retained and the body can return to the normal body temperature. Conversely, when the body temperature rises, the blood vessels dilate and this results into heat loss to the environment. Again, the body can return to the normal body temperature. So this phenomena, when the temperatures of the environment change and the body tries to maintain its internal temperature, this is an example of homeostasis. In the same way as the body maintains it, each and every cell of the body is also trying to maintain homeostasis. It has to maintain because it metabolizes, there is metabolism in the cell is differentiated, it is specialized, there are neighboring cells which places constraints on it, and there are availability or disavailability or non-availability of metabolic substrates. So because of all these factors, the cell has to undergo certain processes which are called homeostasis. If I tell you the exact definition of homeostasis, homeostasis is a process that regulates chemical and physical parameters in the internal environment so that the conditions are always suitable to meet the needs of the cell. So whatever this term or whatever this long and short of the definition is saying, the gist is that the cell maintains itself through various processes and these processes are called homeostasis. This is a very nice illustration given in Robin's book, and it essentially tells you all that is there in this chapter number 2. We begin with the normal cell, that is homeostasis. What happens when a normal cell is exposed to stress? The stress causes certain changes in the cells, and these cells are called adaptations. If the cell is unable to adapt, or if there are the injurious stimuli is so large that the cell cannot adapt, it undergoes injury. This injury is of two types: reversible injury, where the cell can come back to the normal, or irreversible injury, when the cell cannot come back to normal. Irreversible injury is of two types: necrosis and apoptosis. This portion, that is adaptations, will be dealing today. The rest of the portions will be covering in another video. So let's see the example of a cardiac myocyte. Cardiac myocyte means the cardiac muscle cell. This is the normal cardiac muscle cell, and this is the cross section of a ventricle. All right. This is the lumina or the heart chamber, and this is the heart muscle. This is a normal myocyte. When the myocyte is exposed to increased load, or we can say stress, the myocyte undergoes hypertrophy, or it increases in size so that it can still keep pumping. One of the best examples is hypertension. As you can see in the cross section, the thickness of the muscle has increased a lot and the lumen has narrowed down. So the cell is trying to adapt to the stress of hypertension, and such a change that happens is called hypertrophy, or this is a form of adaptation. On the right side, you can see injury. That is, the cell is not able to adapt, or the stress is so much that adaptation is not possible. Then it undergoes injury. Injury is of two types: reversible injury. Here there is reversible injury to the myocyte. You can see certain vacuoles appearing in the cytoplasm. If the stress is removed at this portion, at this point, the cell can undergo, or cell can go back to the normalcy, that is normal myocyte. If the stress is not removed even at the point of reversible injury, it undergoes an irreversible injury or cell death. So this is irreversible injury. You can see this portion of the myocardium has undergone infarction or necrosis. So coming to the definition of adaptations, when you study any definition, it is better to divide it into subheadings, or we can say sub-portions, so that you remember each portion. First, try to understand what each portion means, then it's quite easy to remember the definition. So adaptations. First, what is the cause of adaptations? So when a cell is exposed to stress, it adapts. So when the cell is exposed to stress, stress can be physiologic or pathologic. Physiologic stress can be pregnancy or exercise. Just an example, pathologic stress can be hypertension if we consider cardiac muscle. It undergoes a reversible change. Of course, adaptation is reversible. What type of change it undergoes? It undergoes a functional and a structural response. So if I try to explain this on the basis of the example we saw last, that is cardiac muscle, what is happening is the cardiac muscle is undergoing hypertrophy, and because of this hypertrophy it is able to again pump properly. So it is a functional response. It is undergoing hypertrophy, so the thickness of the wall is increasing, so it is undergoing a structural response. What happens due to this response? New but altered steady states are achieved. That is, the heart is again able to pump blood, so this is a new state, but it is an altered one because the lumen of the heart, or the lumen of the heart chambers, is narrowed, as a result of which less amount of blood fills into the chamber. So it is a new but altered steady state, and this allows the cell to survive and continue to function. All right, so that is the definition of adaptations. Adaptations are of various types, and this figure is quite illustrative of that. This is a normal bronchial epithelial cell. What is the difference between A and the normal? It is lesser in size. So when the cell decreases in size, it is atrophy. B, the cell is increased in size. So this is hypertrophy. The cells have multiplied in number in C. So such a change where one changes to many is called hyperplasia. D is metaplasia, where one cell type is changing to the other. We'll come to that when we'll study metaplasia. For now, it will suffice that one type of cell is changing to other, or we can say a columnar cell is changing to squamous cell. And lastly, E is dysplasia. Dysplasia is a precancerous change. We'll be studying it in chapter on cancer, not over here. First adaptation is atrophy. Let's see a few examples. This is a muscle that has undergone atrophy. This is the normal muscle, and this is the muscle that has undergone atrophy. This happens when there is a fracture and you put a plaster cast. When you remove the plaster cast, say after a month or so, the muscle that is involved in the plaster cast, it undergoes atrophy because it is not used. Next example is that of brain. This is a form of atrophy of the brain when you do not use your brain, like all of you students, you do not use your brains. Jokes apart, this happens when there is a ischemia. Ischemia means loss of blood supply. So brain atrophy due to loss of blood supply is an example of atrophy again. This is an example of muscle wasting or muscle atrophy happening due to protein energy malnutrition. This happens due to loss of nutrition. So atrophy is defined as reduction in size of organ or tissue due to decrease in cell size and number. So the important point over here is that the atrophy is happening due to decrease in cell size as well as number. Okay. Atrophy is of two types, physiologic and pathologic. Physiologic atrophy example is that of embryonic structures. You know that in the embryo or when the fetus is developing, there are certain structures in the fetus like notochord, thyroglossal duct or umbilical cord. These structures are not required once the child is born. So these structures undergo atrophy after the birth of the child. Postpartum uterus, after the child is born, the uterus again goes back to its original size. This happens through atrophy. Disuse atrophy in pathologic, we already saw the muscle undergoing atrophy inside a plaster cast. Denervation atrophy is an example of atrophy that happens when the nerve supply to a particular muscle is cut. Ischemic atrophy, we saw the example of brain. Loss of nutrition, protein energy malnutrition causing atrophy of the muscles. Loss of endocrine stimulation, best example is that of breast after menopause. That is, once menopause is there, the hormonal supply to the breast is cut off. The normal hormones, they do not stimulate the breast anymore. Therefore, it undergoes atrophy. And pressure atrophy. Pressure atrophy is a term used for the atrophy occurring due to compression by a tumor. Say for example, you take a kidney, there's a renal cell carcinoma in the kidney. It's growing so large that it is compressing the normal kidney. So the normal kidney undergoes atrophy and the tumor keeps growing. So this form of atrophy is called pressure atrophy. There are two main mechanisms of atrophy. One is decreased protein synthesis and increased protein degradation. So both due to decrease in synthesis of proteins and increase in degradation of proteins, this happens. That is atrophy happens. Let's go to the next adaptation, metaplasia. Here we'll take the example of parrot's esophagus first. So what is Barrett's esophagus? If you know that the normal esophagus is lined by squamous epithelium and the normal stomach is lined by columnar epithelium. Now the stomach has, or rather stomach produces acid, which is hydrochloric acid. Some point in life, everyone experiences what is called as heartburn, which happens due to reflux of acid into the esophagus. This reflux of acid causes changes in the lining epithelium of the esophagus. So it changes from squamous epithelium to columnar epithelium so that the esophagus can protect itself. So this change from squamous to columnar epithelium at the lower end of the esophagus is called metaplasia. Another example we can take of is a respiratory epithelium. Normal respiratory epithelium is columnar, ciliated columnar to be precise. In a smoker, the smoker is inhaling a lot of toxic substances. These substances induce a change from columnar to squamous, right? So these both are examples of metaplasia. So definition wise, metaplasia is a reversible change in which one differentiated cell type is replaced by another differentiated cell type. Important thing to remember is if the stimulus is withdrawn at a proper time, metaplasia is reversible. That is, if the acid reflux in case of Barrett's esophagus is withdrawn or you treat it properly, it can go back to normal. If a smoker stops smoking, it can go back to normal. However, if the stimulus persists, this metaplastic change can become malignant. What are the mechanisms of metaplasia? It is because of reprogramming of stem cells. So you know that the stem cells are the ones which can differentiate into various other tissue types, right? It is present in almost every organ. So because of the stimulus, like in case of Barrett's esophagus acid reflux, it causes reprogramming of stem cells. And so now the stem cells, instead of producing squamous epithelium, start producing columnar epithelium. Next adaptation is hypertrophy. Let us explain, I'll try to explain it to you with the help of the example of heart. A heart, this is the normal heart chamber where you can see this is the normal thickness of heart muscle. Here the heart muscle has increased in thickness. Here the lumen is fairly adequate. Here the lumen has narrowed. So this is an example of hypertrophy of the cardiac muscle. This is a normal uterus. This is a hypertrophied uterus where the uterus has increased in size. So what is hypertrophy? It refers to increase in size of the cells that results in increase in size of the affected organ. This increased size of the cell is due to what? Each cell contains proteins mainly, and so to increase the size of proteins, increase the size of cells, there have to be increased synthesis of proteins. So cells synthesize more proteins and number of myofilaments increases. Because of increased myofilaments, there is increased force that each myocyte can generate. The first chapter you have studied about the cells that cannot multiply. Whatever cells that cannot multiply in adult life, they undergo hypertrophy. For example, muscles in bodybuilders and cardiac muscle in hypertension. So mechanisms of hypertrophy. As you can see through this illustration, there are various factors that act on the cells which cause hypertrophy of the cells. Uh, Mechanical stretch, agonists like alpha adrenergic hormones, growth factors. The essential gist of it is all these pathways converge to cause increased synthesis of contractile proteins, and this improves the mechanical performance. You don't need to remember all the pathways in detail right now at this stage, but the important point is how they converge to cause increased synthesis of contractile proteins. Lastly, we'll be seeing the adaptation of hyperplasia. What this illustration here says or shows is the Greek god Prometheus and a vulture who is daily coming to eat a piece of his liver. The story behind this I'll be showing in a short video later on. Just to remember, or at this point, it is important to note that the vulture used to daily come and eat a piece of his liver, but the next day when he used to come, he saw that the liver had gone back to its original size. That is, the liver had regenerated, and this regeneration of liver happened through hyperplasia. So what is hyperplasia? It is defined as increase in number of cells in an organ or tissue in response to a stimulus. It is physiologic or pathologic. Physiologic hyperplasia example is female breast during pregnancy. What happens during pregnancy? The breast increases in size, especially the epithelium or the ductular epithelium. So there is hyperplasia of the breast in pregnancy. Liver, the example I just showed you, there is regeneration of liver. That was a story in mythology, but the important point here is whenever a person donates a portion of the liver, his liver also regenerates. Whenever there is iron deficiency or folic acid or vitamin B12 deficiency, patient suffers from anemia. To treat this anemia, we give iron supplements or folic acid and vitamin B12 supplements. What happens after giving supplements? The bone marrow regenerates, and this regeneration happens through hyperplasia. Endometrium after menstruation. You know that the menstrual cycle is divided into proliferative, secretory phases and then menstruation. So once in menstruation, all the endometrium is shed off. The regrowth of endometrium during proliferative phase happens through hyperplasia. Pathologic hyperplasia, when you are trying to treat bleeding disorders of the uterus or bleeding disorders in females, we try to usually give hormones. So in response to these hormones, there is hyperplasia of the endometrium. There is hyperplasia of prostate in old age. It's a very common disorder or disease that is seen in old age patients. They suffer from crippling incontinence of urine, and this happens, or there is hyperplasia of prostate in this case. A virus called human papilloma virus causes warts on the skin, and these warts happen due to hyperplasia. So the virus induces hyperplasia in cells of the skin. What is the mechanism of hyperplasia? As you can guess, hyperplasia results due to growth factor driven proliferation, also because of reprogramming of stem cells again. That is, there is increased output of new cells from tissue stem cells. So let's see this video, which is showing the story of Prometheus. I hope you'll enjoy this.
Before the creation of humanity, the Greek gods won a great battle against a race of giants called the Titans. Most Titans were destroyed or driven to the eternal hell of Tartarus. But the Titan Prometheus, whose name means foresight, persuaded his brother Epimetheus to fight with him on the side of the gods. As thanks, Zeus entrusted the brothers with the task of creating all living things. Epimetheus was to distribute the gifts of the gods among the creatures. To some he gave flight, to others the ability to move through water or race through grass. He gave the beasts glittering scales, soft fur, and sharp claws. Meanwhile, Prometheus shaped Before the creation of humanity, the Greek gods won a great battle against a race of giants called the Titans. Most Titans were destroyed or driven to the eternal hell of Tartarus. But the Titan Prometheus, whose name means foresight, persuaded his brother Epimetheus to fight with him on the side of the gods. As thanks, Zeus entrusted the brothers with the task of creating all living things. Epimetheus was to distribute the gifts of the gods among the creatures. To some he gave flight, to others the ability to move through water or race through grass. He gave the beasts glittering scales, soft fur, and sharp claws. Meanwhile, Prometheus shaped the first humans out of mud. He formed them in the image of the gods, but Zeus decreed they were to remain mortal and worship the inhabitants of Mount Olympus from below. Zeus deemed humans subservient creatures, vulnerable to the elements and dependent on the gods for protection. However, Prometheus envisioned his crude creations with a greater purpose. So when Zeus asked him to decide how sacrifices would be made, the wily Prometheus planned a trick that would give humans some advantage. He killed a bull and divided it into two parts to present to Zeus. On one side, he concealed the succulent flesh and skin under the unappealing belly of the animal. On the other, he hid the bones under a thick layer of fat. When Zeus chose the seemingly best portion for himself, he was outraged at Prometheus's deception. Fuming, Zeus forbade the use of fire on Earth, whether to cook meat or for any other purpose. But Prometheus refused to see his creations denied this resource. And so he scaled Mount Olympus to steal fire from the workshop of Hephaestus and Athena. He hid the flames in a hollow fennel stalk and brought it safely down to the people. This gave them the power to harness nature for their own benefit and ultimately dominate the natural order. With fire, humans could care for themselves with food and warmth.
That brings us to the end of this lecture. It's usually my way of posing a few questions to the students to know how much they have understood. I am posing four questions over here. The first question is the one which I'll be answering now. Rest of the questions you go through and we'll be discussing it in the beginning of the next video. So first question is, what does a cell do when it is exposed to stress? Note that more than one options are correct over here. It undergoes dysplasia, undergoes metaplasia, it tries to adapt, or it tries to achieve homeostasis again. So my question is very specific. What does a cell do first when it is exposed to stress? Yes, I think you must have guessed it right. When the cell is first exposed to stress, it tries to adapt and tries to achieve homeostasis again. Right? So go through the other questions. I'll tell you the answers in the next video, and I think you will be able to know. So thanks a lot for listening in. This is a channel, Pathology Basics, and I'll be uploading more videos covering almost all aspects of pathology, important from undergraduate point of view very soon. If you like this channel, please subscribe to it and spread a word among your contacts. Thanks a lot.